Capstone Case Study Presentation by Stephen Brewer for Brandman University. The trainee completed his practicum at Family Assistance Program located in Victorville, California. His supervisor was Sheila Paul. The primary language spoken in the home is English. However, the client, herein referred to as Jackie, is fluent in Spanish. The client was raised Catholic and requested that the religion be incorporated into therapy. The client is currently unemployed and is receiving disability benefits. The client has 5 children in total, but only 2 of them live with her. The client has been married twice and is currently single. The 2 children that live with the client, her son and a daughter, are 13 and 17 respectively. Her other 3 children live with their father in West Covina. Jackie also has 2 sisters that live in Orange County, California. Jackie's mother and stepfather live in Fullerton, California as well. As you can see, Jackie has a history of domestic violence, physical abuse, and substance abuse in her past. During the first session, the trainee reviewed the required forms by Family Assistance Program with Jackie. Included in these forms is a client information form, consent for treatment, confidentiality, acknowledgement of privacy practices including HIPAA, a copy of the said privacy practices, and client rights. The trainee's status as a student trainee working on his master's degree was also discussed with Jackie, and the trainee mentioned that he was working under the supervision of a licensed marriage and family therapist. The trainee also mentioned that he would be discussing Jackie's case with his supervisor. The trainee provided the client with the name and phone number of his licensed supervisor, as is required by Family Assistance Program. The trainee then went on to discuss what is said during session will remain confidential, but did discuss the limits of confidentiality with the client. Trainee explained the instances in which confidentiality could be broken, which included if the client was a danger to herself or to others, if there was any type of abuse, physical or sexual, a subpoena, or the Patriot Act. Jackie then completed the Beck's Depression Inventory and scored a 42. This placed her in the extreme depression category. Jackie then completed the Beck's Anxiety Inventory and scored an 11, which indicates a very low level of anxiety. The trainee completed a mental status examination for Jackie and continued to assess her for suicidal ideation on a regular basis throughout treatment. The trainee also completed a suicide risk factor form. One major cultural issue that presented itself during treatment was the client's simple brushing off of the physical abuse that she suffered when she was a child. This was linked back to the client's Hispanic background, as it is common in Hispanic culture to not really talk about such abuse and to keep such things out of the public eye as much as possible. The trainee found it to be a challenge at times to help Jackie place the proper emphasis on the actions of her father. The family's religious background also put a strain on the relationship between the client and her mother. Initially, client's mother wanted to remain out of the public eye and keep the subject of the abuse under wraps, and remain quiet about it due to keeping up a public persona of being a strong Catholic family. This drove a wedge between the client and her mother. Further down the line, the client left Catholicism behind and identified as being a Christian. This also placed a strain on the relationship between the mother and the client because the mother became far more judgmental about Jackie and her experiences. Jackie reported a gradually increasing history of episodes of domestic violence with her most recent ex-boyfriend, hereto referred to as Paul. As you can see, this second incident, Paul began to escalate his behavior to the point where he began to lightly push Jackie on her shoulder while talking in the car. In the third and final instance of domestic violence, Paul finally became physically violent with Jackie. It began as a verbal altercation, but then it turned into something much more. The initial and primary concern was that of the client's history of suicidal ideation and hospitalizations. There were instances throughout treatment that safety contracts had to be used, and the trainee consistently checked in every session with the client to make sure that she was feeling okay. Anxiety also played a part in developing crises in Jackie's case. The client lived in close proximity to her physically violent ex-boyfriend, so this produced a high amount of anxiety and hypervigilance in regards to her safety. This mental fatigue would give way to depression for Jackie, and in turn, it would give way to suicidal ideation at times. One good thing about this client is that she was very vigilant about her having diabetes and taking her medication and staying current with it. She was also vigilant about how her psychotropic medications would interact with her diabetes medication. Despite this vigilance, the trainee would consistently check in with her to see how she was feeling in regards to her medical health. As stated earlier, the biggest concern during treatment was to ensure the safety of the client. The client had a history of hospitalizations, attempts, and suicidal ideation, so the trainee used weekly check-ins and also assessed for plan, means, and intent whenever extreme depression or suicidal ideation was reported. When it was reported, the trainee used safety contracts with the client to ensure the client kept herself safe. Another concern the trainee had regarding the safety of the client was within the context of domestic violence, more specifically living in close proximity to her ex-boyfriend. The client had taken the necessary steps in getting a restraining order, but the close proximity of the perpetrator was still a major concern during treatment. The client's diagnosis included bipolar I disorder, most recent episode depressed without psychotic features, PTSD acute, physical abuse of adult victim, and parent-child relational problems. The client's GAF score was 51. The trainee went with the diagnosis of bipolar I disorder, most recent episode depressed without psychotic features, mostly due to the diagnosis being included in an assessment by another therapist previous to the trainee getting the client. And the trainee also found this diagnosis to be appropriate due to there being a mixed episode experience in the past, and the client most recently experienced a depressive episode. PTSD was used as a second provisional diagnosis, and this was due to the client experiencing intense psychological distress at exposure to external cues, physiological reactivity on exposure to external and internal cues, markedly diminished interest in activities, feeling of detachment from others, restricted affect, difficulty sleeping, and hypervigilance. The acute specifier was used due to the duration of the symptoms being present for less than 3 months. The third provisional diagnosis was that of physical abuse of an adult victim. The clinician arrived at this diagnosis due to the history of physical abuse and domestic violence experienced by the client, with the most recent domestic violence incident included. The trainee found it necessary to diagnose parent-child relational problems due to the strained relationship that Jackie experiences with her mother as well. In Access 4, the trainee found the client to be experiencing numerous problems. The first problem was issues with her primary support group. The client does have a strained relationship with her mother and is at odds with her a lot of times, and most of her family lives in the Orange County area, so the client had no familial support living in the same area as her. The client also has occupational problems. She's unemployed and is receiving disability benefits due to a car accident she experienced. This leads into the next problem for the client, which is she's only receiving disability benefits, so at times she's strapped for cash and finds a disability income to be inadequate. Lastly, Jackie reported that she has discord with her son's therapists, CFS, and the educators presiding over her son's IEP meetings. For treatment, the trainee used CBT, cognitive behavioral theory, during the treatment for this client. Aaron Beck first developed CBT in the 60s and called it cognitive therapy. Beck devised a structured, short-term, present-oriented psychotherapy for depression, directed towards solving current problems and modifying dysfunctional thinking and behavior. The trainee thought this was great for the client, and so that the trainee could help the client address inaccurate and or unhelpful thoughts that led to depression. Jackie had dysfunctional, inaccurate thoughts and beliefs about herself. This stemmed from her experiences as a child with the physical abuse at the hands of her father. This helped Jackie develop a dysfunctional core belief about herself, and this core belief has permeated all her decisions throughout her life. Jackie's depression is also linked to this inaccurate, dysfunctional core belief. She believes herself to be worthless, and this belief is what fuels her depression. The trainee also used CBT in treating Jackie's anxiety and catastrophizing due to her PTSD diagnosis. By using CBT to help the client identify and challenge her faulty and dysfunctional cognitions, the trainee would be able to break through the anxiety that causes her physiological symptoms and significantly impairs her in daily life. The trainee used a non-CBT technique, the miracle question, just to get a clearer picture of what Jackie wanted to achieve from therapy. And this actually helped, it was valuable and helped shed some light on what Jackie desired from therapy and actually shed some light on her personal goals. It brought out that the client had a deep desire to make changes, and she was tired of living in the same cycle of domestic violence. The trainee initially worked with Jackie on identifying automatic thoughts. He had Jackie write down her automatic thoughts on index cards as soon as she had them. Trainee did this in session a few times with the client just to make sure that Jackie had a good understanding of what she was doing with the exercise. At the end of this session, the trainee gave Jackie some index cards and told her he wanted her to take them home and use them to write down her automatic thoughts for homework and bring them back to the next session. The client's automatic thoughts were then discussed and challenged using Socratic questioning. After the client got a grasp on challenging her automatic thoughts, the trainee sent her home with index cards again and told her that he wanted her to write down the questions she used to challenge her automatic thoughts and the answers that she got from them. The trainee began practicing creating pros and cons lists in session with Jackie, and once Jackie got the hang of it and was confident she could use it effectively, the trainee gave this technique as a homework assignment. Jackie began using this technique at home, and she would bring in the pros and cons list to sessions so we could go over it together. Long-term goals for this treatment included improving the client's depressive symptoms, improving self-image, and alleviating Jackie's anxiety. The short-term goals included reducing levels of anxiety by helping the client identify dysfunctional or inaccurate automatic thoughts, terminate suicidal ideation triggered by anxiety, and helping the client develop healthy cognitive patterns in regards to self and others to decrease depressive moods and symptoms. Termination was discussed from the outset of therapy. During the initial session with Jackie, the trainee sporadically reinforced throughout treatment termination as something that would inevitably arrive. Because of this, the trainee worked with Jackie to provide skills, and those skills would work to empower Jackie to do those things on her own without the trainee around. When termination did arrive, Jackie reported feeling confident in using the skills and tools learned while in session, and she felt confident that she could do these effectively and on her own. One prevalent issue, countertransference-wise, for the trainee was the client's religious background. The trainee had a personal experience of mistreatment by a religious organization. So when the client brought up her own experience of mistreatment, it immediately brought out the trainee's own experience and the feelings associated with that. The trainee was able to address this concern with his supervisor and was able to move past this issue and competently help his client. A transference issue was one with the client that she had with the trainee due to the client's background with men. The client was very untrustworthy of the trainee in session.